arthritis is damage to the cartilage of the ankle joint. And if we can take off an ankle joint or cartilage like we have treads of the car, with the passage of time, the treads of the car wear down and then you have to go and get it replaced. Similarly, I've broken the ankle, someone's, and this is the undersurface of the tibia where there is cartilage, and this is the top of the talus where there's cartilage. And normally this would sit like this, and I'll fix the ankle again. So this cartilage on the top of the talus and on the inside of the tibia weighs down, and when this cartilage weighs down, then people get arthritis of their ankle. This can happen because of the inflammation, like people have got rheumatoid arthritis. This can happen as a result of osteoarthritis. This can happen as a result of post-traumatic arthritis, like somebody broke their ankle joint and then the arthritis set in. Or most commonly, it can happen with people who have small repeated damages to their ankle over years, like playing football or something, which does small damage and over time it gets bigger. Walking is good in that sense that it would help you maintain the motion of your ankle and would stop it from being stiff. And especially if one is considering to have an ankle replacement, they think that, oh, it doesn't matter how stiff my ankle is, once I had my ankle replaced, my ankle would move more. But if the ankle becomes stiff because of arthritis, because we're not moving it, then it would not be recovered even if we do surgery like ankle replacement. So generally, the principle is that any movement, and especially in ankle, because we can only move when we're walking, is good for the ankle arthritis, but it may be associated with increased pain because of the movement, because as the ankle tries to move up and down, like if this is the ankle and it moves ups and down, then it can cause arthritis. It can cause pain, not arthritis. Massage is not good for arthritis if we look at the medical evidence. And I'm not aware of any medical evidence where the massage is good for ankle arthritis. If somebody has got arthritis in the hip, one can say, look, the muscles around the hip, because of the inflammation, they would be affected. And then if you do massage, that would be good. But ankle, if you look over here, you can see on the inside there's bone, and on the outside there's bone. At the front there's bone, and the only muscles at the ankle are at the back. So if you're getting aches and pains at the back, then obviously you can do a massage there. But at the front and the sides, there is hardly any muscle. There are only tendons and ligaments. So generally thinking, I don't think that massage would help unless your pain is primarily at the back, where there's a flexor hallucis longus muscle, which is normally called as the beef of the heel.
Okay.
The exercises which one should do for ankle arthritis is, one is range of motion, which I said, to move the ankle up and down, move it side to side and circumduct it. And the other exercises are that one should do what is called as proprioception exercises, where you either stand on a wobble board and try to maintain the balance, or you take a pillow, fold it in half. If this was the pillow, for example, and then you fold it in half, it makes it unstable if you stand on it and hold on to something. It's important you hold on to something so that you do not end up falling and fracturing your ankle. And it helps you maintain the proprioception. So this brings us to the question of what is a proprioception? Proprioception is the signal which goes from the joint directly into our brain without us thinking about it. It's like when you wake up in the middle of the night, you have to open the bathroom door handle. You don't think, okay, I have to turn on the light where the door handle is. You cannot see it. But because you live in your house, you exactly know where the door handle is. It's pitch dark. You go, you put your hand onto the door handle and turn it. So that's what proprioception is, and exercises are good to maintain proprioception. I think that's a very good question and very difficult question. If we can lubricate our joints naturally, then this is a billion-dollar question, and we would be able to prevent arthritis. Body has got natural joint fluid, which is over there to lubricate the joint. because although the cartilage is really smooth, but if we have a joint fluid that reduces the friction, and the nature is trying to reduce the friction, so that if the friction is less, the surfaces would glide and move easily, and then they would wear out less. But we have developed some artificial joint fluids like hyaluronic acid, which we can give people in early arthritis. But we have not yet developed a pill where we can give it to people and they can increase the joint fluid. There are some other things which people can do to help the cartilage, like taking chondroitin sulfate or glucosamine tablets. And the evidence for them is that in rheumatoid arthritis patients, they found that if they had the sulfate component in the tablets, then they help. But if they did not have the sulfate component, then it does not help. So I normally advise my patients to keep a pain diary where 0 is no pain, 10 is the worst pain, and keep a pain diary for about a week or so before start taking medicine. And take these, I'm saying medicines, but they're not actually medicines. They are supplements, over-the-counter supplements. So take these supplements and keep the pain diary. And at the end of 3 months, see, have they made a difference to your pain and your function and quality of life? If they have, then I would continue taking them. Otherwise, I would say stop taking them.